started. We're just 2 minutes after the hour. Welcome everyone to the HCBS Rate Determination Forum number 1. This presentation focuses on care coordination, personal support, and supportive skills building for sections 12, 18, 19, 20, 29, and 96. Public Consulting Group is a public sector focused management consulting firm that assists public agencies in serving their targeted populations, specifically human services, health, education, and technology consulting. In particular, many of our projects are focused on rate determinations, much like this work that we are presenting today in collaboration with MaineCare. So our agenda for today is going to start out with some welcome and reminders. We'll jump into introductions. Then we'll talk through rate reform process and review. Then we'll discuss draft rate setting methodology and those model inputs. And then we'll discuss the draft rate recommendations, next steps, Q&A, and details for public comment. So I will go ahead and pass it over to Kristen.
Thanks, Kristen. Hi, everyone. I'm Kristen Merrill. I'm the Associate Director of Program Implementation within the Office of MaineCare Services. And I just want to start off by saying a big thank you to everyone for their time and their participation today. We will be diving into the MaineCare rate reform process and draft recommendations in just a few minutes. But before we do that, I just wanted to take a moment to touch briefly on a few things related to this effort. So the first is that, obviously, as most of you know, this was a very large effort and it's taken a lot of time. And it has overall touched on 9 different sections of the MaineCare Benefits Manual and close to 130 different service codes. These draft rates will be presented across 3 different presentations or forums over the next couple of days. And so part of the goal of MaineCare rate reform is alignment across sections of policy, or to say that differently, an effort to create payment equity where the same or similar services under different sections of the MaineCare Benefits Manual live. So this can sometimes result in draft rates that recommend increases in some areas and or decreases in others. And some of the things that we've considered as part of this effort, there was and will continue to be considerations of state and federal requirements. This includes things like Maine statute. An example of that is 22 MRS 7402, which is the Essential Support Worker Reimbursement Statute, which requires that the wage component of certain services under certain sections be equal to at least 125% of minimum wage. Next slide. Please also note that while draft rates are developed using inflation through January 2027, we still do not have an implementation timeframe because of various factors or actions required to implement these changes. So sometimes these additional steps can limit implementation timelines or implementation in general. And so along with this formal rate reform process, there can be other steps required by the department in order to implement any rate recommendations, which can include things like budgetary asks and appropriations or approval from the Maine state legislature. We could also be required to undertake rulemaking in accordance with the Maine Administrative Procedures Act process. We do often have to seek federal authority for changes, especially rate changes, which can include state plan amendments and waiver amendments, 1915C, home and community-based waivers in particular. And so those do require approval from the Center for Medicare and Medicaid Services. And one thing that I think is really important to note, especially as it relates to those 1915C home and community-based waivers, is they do require that, CMS does require that states be able to show cost neutrality. And this just means that the average cost of caring for a person in a home or community-based setting can't exceed what the government would have spent if the same person were placed in an institution like a nursing home or hospital. So keep in mind that some of these rates that you'll see draft recommendations for today have not been updated in many years. And so those older rates use older models, which did not include things like minimum wage changes that went into effect several years ago. These draft rates do update the whole rate and assumptions, not just wage-related data. And most of the data is based on a combination of what was submitted by providers during our early forums, but also information that was gathered from external sources as well. So final rates may change based on further review and consideration of any input received through the comment phase of this rate determination. And so we really just appreciate everyone's time and input so far, but also looking into the additional input through the next phase of this project. And so with that, I will pass it over to Jess to start introductions.
Hey everyone, I'm Jessica Levesque from the Delivery System Reform Unit. I'm a coordinator on this project. As you can see, this is your main team that's working on this project with PCG. Kristen introduced herself. We have from the policy section, Heather Banglis, Megan Brooks, Dwayne Parsons from rate setting. He's the senior manager of reimbursement. And then from Oates, we have Nicole Rooney and Derek Fales. Next slide, please. I'll just say that as if anybody on the team speaks, they'll introduce themselves as they come off of mute for you. Kristen?
All right, thanks, Jessica. I'm going to go ahead and do a brief introduction for the PCG team. So I'm a senior consultant, project manager for this initiative. My name is Kristen Gore. With me today, I have Rhonda Kern-Strauser. She's a senior advisor. Jeremy Thomas, who's a senior consultant. Erica Altman, our amazing business analyst who will be on taking notes and monitoring the chat for us today. And then other folks who are not on today but are project supports and leadership include Megan Morris, Joseph Corbeau, and Luke Lofgren. All right, and with that, I'll pass it back to you, Jessica.
Oh, okay. Thank you, Kristen. So for people who are new to the rate reform process, we like to take some time to go over the 3173-J, which was codified in 2022. So to go over at a high level, what this main law does for rate reform is it ensures that there's a regular schedule for rates to be reviewed and adjusted. It looks at if those codes or rates now are relevant to state or national data. Can we benchmark anything to Medicare? That sort of thing. So we always look at benchmarking first, and you'll see some examples of that today and in the other presentations we're going to do. Then also, well, what we're doing today. So the process for this new law is important because it formalizes a clear and transparent process for rate determination. So it's giving you an opportunity to see what we're doing, how we're developing these rates, these methodologies, and for you to be involved and for you to give your feedback. So super happy to have you here and being involved so that we can hear your feedback. And then also there's a portion of the main law that has the Main Care Advisory Committee you'll hear called the MAC, and they meet separately. And that's new for reform specifically. And then we also have a technical advisory panel that meets, and you may hear that referred to as the TAP. Next slide, please. This is specific to this rate study. So if you've been involved from the beginning, the initiation notice went out in June of 2024. And then there were a series of kickoff meetings that were held. This is a large project, as both Kristens have stated. And so we have split this into multiple sessions throughout this project. So we started those in August of 2024. Then we had a series of engaged interested parties meetings that went from September 2024 through October. Then we sent out some surveys. So hopefully you've been able to be involved in this process right along. And now today will be the end result that we've all waited for the draft rate presentations. And there will be 2 more meetings that will give you specific dates for. Like I had stated in the previous slide, after today's meeting or also during today's meeting, you have an opportunity for public comment on these draft rates. We will need you to submit them if you're submitting them in writing by July 13th. And we will provide you with the email for that in the chat, and you'll also have it in the presentation. After we receive all the written comments, then that part of the process is we take that back. We consolidate the alike comments, we provide a written response, and then that's posted on our website page. And then there'll be a rate finalization after. And we do update you with all of this information through email notices. So today's presentation is for draft rates. And next slide, please. Okay, so these are the meetings I was referring to. So today is the sections that we talked about earlier. They're the care coordination, personal support services, and support skills building. Tomorrow's meeting, if you haven't registered and it applies to you, there's one tomorrow on different services that starts at 10 a.m. It's clinical services and clinical therapy services. Then we'll be hosting our third meeting on Monday at 1:30, and that's for therapeutic interventions and assistive technology. So those went out by notices, and you'll need to register. And if those pertain to you, please do. Also, if you have any questions or need those links sent to you, feel free to let us know or email one of the emails, and we'll get those to you. Next slide, please. Okay, here's where I'm going to turn it over to Kristen.
All right, thanks, Jessica. I think we're actually going to pass it over to Rhonda for this section.
Perfect. Hi, everyone. I'm Rhonda Kern-Stralzer. I'm a senior advisor of behavioral health here at PCG, and I'll be kind of talking about some of the methodology and the model inputs. Next slide, please. So one of the first things, we're talking about the independent draft rate model approach. And some of the buckets you see here, the large kind of overall buckets where the model reflects actual provider costs and the use of multiple data sources that we're going to talk about here first in this kind of larger context. Some of these things are utilized to have all these leverage support rate model inputs put in, such as the staff wages or benefits, staffing levels, service settings, time to complete service, like, if it requires documentation and those things, as well as transportation costs. So in large buckets, we started with state policies and laws and rules, which are the program policies, rules, and regulations in the main care benefit manual. We looked at national resources, which is BLS wage data and IRS mileage rates, provider and interested party input, as just mentioned. We had the provider survey as well as interested party outreach. And then we also have alternative resources that we looked at, like Medicare benchmarking and peer state benchmarking. Next slide, please. So as we start breaking this down a little further, let's talk more about models and the component within the structure. So again, we utilized actual provider costs and used multiple data sources that we talked about just on the previous slide. And in each of these next buckets below, these are the high level steps we utilize to calculate the service rates. And each one of these was calculated by dividing the number of participants by the total hourly individual rate. So when we started looking at personnel cost, what went into that is direct service staff salary, direct service staff tax and fringe benefits, and there was also a productivity adjustment. We then added on non-personnel cost, which is program support, overhead, and mileage. And then we got a total program cost for all program spending. Once we got that, we then divided it by the number of participants when we started looking at individual services. I do want to note there is a 10% incentive added for all group services at this point that we have added on, and you'll see some of that reflected in the modeling as we go through this. Next slide, please. So let's talk about some of these benchmark rate variables. So one of the first things, of course, is direct service wage, staff wage. That is variable. And why that benchmark is variable, because of course you have nurses, or you may have PT, OT, or nursing assistants, or a variety of different staff. So that benchmark is variable, and we'll talk a little bit about that in the next few slides. But the data source for that's BLS, and we pulled that data based on May of 2024. Next thing is fringe and benefits. So the benchmark was 946 plus 8.15%. The data source for this was BLS in 2024, as of December 2024, and then also the main tax. So this was variable adjustments to the benefits based on wages for Maine specific payroll related taxes. So we accounted for that. The non-billable percent, we used 25%, and that was a baseline estimate. The travel time was 10%, and that was a baseline estimate as well, when we also heard from individuals for the different surveys, and then looking at national. So we just created a baseline estimate. Overhead cost is 15% that we utilized. That's the CMS de minimis rate, and this is the standard indirect cost rate used by CMS in the absence of like reliable service data and survey data. So we decided to use that. Program support is 10%. And again, that was a baseline estimate assumption based on 4 hours of direct support service per week. And then last but not least is mileage costs, which is 70 cents, which is the federal mileage rate. And we also looked at the cost of 1 hour of traveling multiplied by the time spent traveling and the average miles per hour. So that's some of the different benchmark variables that we utilize that you'll start hearing about as we work through the next several slides. Next slide, please. So let's look at a draft rate model example utilizing some of the big buckets, and then certainly down into those other specific areas that we just defined. So if you look at this table, the first 5 steps are related to direct service staff cost. And so let's talk about those. So we have the first line is the direct staff hourly wage. In this example, it's $31.05. There's not an adjustment factor because we aligned it directly with the profession that would be providing the service. And so any adjustment factor notes, as it says here, is based on May of 2024 BLS data. The next line is employee benefit rate. That was, in our example, $11.99. We did that adjustment factor of $9.46 plus that 8.15%. Again, we use that fixed and variable based on December employee cost for employee compensation data, which is from BLS data. We then got a total compensation, which is $43.03 in this example. Of course, there's no adjustment factor for that because we just added the 2. Then the next components, we looked at that non-billable and travel adjustment. So the cost per service hour is $1.54. That adjustment factor is 35%. So we applied a 35% productivity adjustment. So for every 40 hours worked, 26 is direct billable time, 4 is travel, and 10 is an additional non-billable. So we associated the cost based on that, which is $1.54 in this example. Once we got that value, we then added all of this together, which would give us the direct cost staff per billable hour of 66.22. We multiplied that by the employee hours plus benefits by the productivity adjustment to get this total cost here. Once we got that, we then next started looking at the next two lines, which are administrative and program costs. So line 6 is the program cost support. And this is based on national benchmarks of 10% of the program support cost. And you can think of this of like, if you have a scheduler or billing or something like this, there is some sort of cost that is a program support cost associated with someone doing the actual work. So in this particular example, it was $883 is the cost per hour that was associated. Then we looked at indirect cost per billable. And again, this may be, the administration or, something like that, maintenance or some other indirect costs that may be associated with providing the service. And in this example, we identified 1324, which is a 15% adjustment factor, which again is that national benchmark of 15% related to those indirect costs. So we came up with those dollar figures for that administrative and program cost. Then we next went to mileage driven, and we looked at the vehicle mileage cost. And this is based on cost of 1 hour of driving multiplied by the average travel time per 1 hour of direct service. And when we calculated this out in this example, we got 507. So when we add all these costs up overall, we get a cost of 93.35 total. And as you can see here, the final draft rate per unit. So then we took that total cost, looked at what the unit of service was. And in this example, it's 15 minutes. And so we took 93.35, divided that by 4, and we got 23.34 per cost per unit. So that's kind of how that breaks down and what we did throughout all of these. So we'll talk about the next slide. So let's talk about a little bit for those wage assumptions. So one of the first things we did is a provider survey result here that we're going to talk about. We did that survey. We took those results and we pulled those all together. And you can see here by position type in the chart, you have the provider survey data, which was the average reported dollar figure for each professional type and how many responses we received. So that's the first thing I want to call out. So once we got that, we started looking at how many people responded, what was the average wage, and then we started looking at the median 2024 BLS data, which is identified further on the right in that gray column. So once we started comparing those, we looked at the wage assumptions from the rate models that are higher than the wages throughout the provider survey, which is that BLS data. And the survey data certainly varied greatly. So therefore, we determined that the BLS data would probably be more consistent and representative to go with. So that's what we utilized and how we came up with utilizing the BLS data for any of the models and the wage assumptions. Next slide, please. So let's further talk a little bit more about BLS data. So again, we use that to determine the appropriate wage for each position. Across the industry median wages, when they were available, that's what we used. And we also are showing here how we came up with the blended wage. So for an example, the 97192, the therapeutic interventions for cognitive function. So the position titles we looked at was therapy plus a therapy assistant blend, because there's a combination of those two professions providing services. So what we did is we looked at the BLS standard occupational classification. So we found the occupational therapist, we found occupational therapy assistant, and we found a physical therapist. And we assigned a weighting to that. So occupational therapist in this example is 50%, the therapy assistant was 20, and the physical therapist was 30%. We then found the median wage according to BLS, identified that, and then did an average hourly wage of all three of those to come up with that blended rate. And you will see that at times throughout the different modeling that we've done, but that's how we came up with the methodology and how to determine that particular rate. Next slide, please. So further, one of the things we've identified here are the wage assumptions for each position, as well as that blended in the draft rate models across all the service types. This table is included in the appendix, so you can see where we came up with these rates, as well as the BLS code. And if there's any weights associated with it, which I think all of them are on this particular one. And then what we would utilize as that BLS median hourly wage. And you can see that. I'm not going to go through each one, but I will say we'll just talk high level, regarding these positions. So looking at care coordination blend, we considered registered nurse, occupational therapy assistant, as well as a social worker. We have a total hourly wage for this particular one of $31.05. You can see the weights there on the side that we assigned to each professional category, as well as that BLS data assigned or associated with each professional category. Same thing occurred with the CNA and the home health associate blend. We use nursing assistant and home health personal care aide. The total hourly blended wage was $21.61, and you can see the breakdowns and the wages for that. Fiscal and intermediary, so we used a health education specialist, child, family, and school social workers for this particular one. Total hourly wage was $31.67, and the percent breakdowns as well as the hourly wage. Health education specialist, that one is 100%. So that is one I missed, as well as the personal support aide of home health and personal care aides, and the total hourly wage there that came out, which aligned with home care and personal aides, is $19.51. And those both are weighted at 100%. And then the supportive skills blend, we use nursing assistant, home health, and personal care aides, as well as social and community managers. That blend came out to $26.99, and you can see the weights there as well as the hourly wage. Next slide, please. So let's talk about fringe and benefits. So the benefit assumptions for the direct support staff were based on the employee costs for employee compensation, BLS average benefits for the private industry of healthcare and social assistance, again, based on December of 2024. So certain benefit assumptions are fixed. However, the benefit rate as a percentage of wages decreases as the wage increases. So let's look at this by benefit category. So we have paid leave or PTO. That's a fixed variable, and we assigned an inflation applied amount to that of $431. We looked at insurance, which is life, health, and disability. That's a fixed amount, but we did apply an inflation rate of $351. Retirement and savings, that's a fixed amount, and we applied an inflation amount for $1.60. And then legally required benefits, which is the main payroll tax, that's proportionate, and that was the 8.15%. So that kind of shows you where and how we develop those fringe benefits and in some of the modeling that you'll see in the future. Next slide. So let's talk about the inflationary factors a little bit. So inflation is applied to all developed rates in order to account for changes in the economic climate, from year to year, right? We do know that those things occur, so we wanted to ensure that those were included here. These factors are calculated using the last 12 months of inflationary data. The rate implementation year of January 2027 was utilized in the modeling. So we applied an inflation factor of 2.68% to all current rate models based on the most recent 12 months of inflationary data available through BLS, or Bureau of Labor Statistics. So inflation adjustments are applied to the BLS May 2024 wage information, as well as the December 2024 employee costs for employee compensation benefits. And you can see here in the table on the left, we have the rate application and the year that we utilized that, and you can see the inflation factors utilized for the models going forward. Next slide, please. And I think this is where I hop off, and Jeremy is going to start talking to you about rates and models and each specific code listed. So,
Yeah, thanks,
Jeremy.
Rhonda.
Yeah.
Really appreciate it. All right, next slide, please. All right, so hello, everybody. I'm Jeremy Thomas with Public Consulting Group. I'm excited to go over the actual model results. So what you see here is one of the several slides we're going to go over today. I want to orient you a little bit to what we're going over on these slides, just so you're fully aware. One of the components is these slides are all ordered to show that consistency that we are endeavoring to create within the service category. Some of these, like this one, were already consistent and already show that consistency in the changes with each of them, but we really want to make sure we're showing the groups as they are existing so you can see all of the components. So what you'll see here is that we're going over the care coordination service proposed rates. You'll see here that this one's for the initial visit, ongoing, and the initial visit, all of which are the same, general service for 15 minutes. And so when looking at these, you'll see here that the draft rate that we are proposing is $23.34, which is about 15% higher than the current rate. So overall, this is the sum of all of the components of what we have covered up to this point. We will go over the models here in a moment once we've covered each of the changes at the highest level, and then we'll cover exactly where the changes can be found. All right, so overall, not really huge surprises here. Same rates, same system, about 15% increase. Let's go to the next slide. So here with this next one, you can see two kind of different services, obviously different time frames. So what we'll see here is that care coordination services for a maintenance visit. You'll see that it actually is a carry forward of that same $23.34 compared to the $20.39, and that's 15%. We did produce a monthly care coordination rate in line with the previous rate that was at $163.10. That one increased proportionately significantly more. Primarily, this is found in the number of hours expected in that care coordination delivery service for a month versus a 15-minute delivery service. So you can see here that while 15-minute unit increased by about 15%, that monthly, all the other assumptions included in that rate also shifted quite a bit, and we see a significantly larger percent increase for that service delivery. All right, next slide. So continuing on, we're going to talk about personal support services, the PCA Super Visit. Here, what you can see is you see the single, the double, the triple, and the quadruple. So here is one of the places where we'll talk a little bit about this new service of 4+. In alignment with the effort to encourage coordination of services in multiple options for our clients, we wanted to make sure to include this 4+ option so that providers or vendors are being fully compensated for those additional youth up to 4, primarily looking at the idea that you would still be getting that 10% bonus. So what you'll see here is all of these rates are actually tied together pretty concretely. You'll see that 67.82 draft rate for the PCA Super Visit. You see that basically is divided in half for the number 2, and then you add another 10% off of that. The draft rate for number 3, it divides by 3, and then you get an additional 10% out of that, and then you drop down to 4 And so what you'll notice if you multiply that 1865 by 4, you actually get quite a bit higher than the singular draft rate. Actually, not quite a bit, 10% exactly. So overall, we see these increasing pretty starkly. These were off base quite a bit. Again, primarily surrounding not only increasing wages and all those other cost components we mentioned, but these are per visit. So the proportional of increase is also related to the number of hours expected. So there is a little bit of rebasing here in how much effort is being provided in these services and making sure that these rates meet that level of effort. Next slide. Same story here with the attendant care PCS, although slightly different. So overall, it is still a 15-minute rate. And so you'll see that all the way down, but it's the exact same structure overall. So you'll see that current rate of 701, 385, and 280. Those increase quite a bit based off of that 10% increase and all the other rebasing components. It's also worth noting here that those percent of increases are significantly higher, primarily because this is a lower cost rate at 15 minutes. So when you see these significant increases, that can be the flat tax rate changing, and that in this kind of smaller component can be just quite a bit proportionally larger. So it's worth making sure we're recognizing that while this is a significantly larger increase, it is as far as the amounts, not necessarily quite as much all the time. So really wanting to rebase that again, and then note that you are getting that 10% bonus for every single group rate in this service category. Next slide. All right, so continuing out this story, you'll notice that this is the exact same story as on the last slide, just with a different section of policy. Again, making sure that we're always pointing out that these are aligning the different sections of policy into one consistent story, and really making sure that that is being represented in all of these rates. No real updates here as far as what's going on. So next slide, please. And continuing again, I think that by showing these out to you, it really helps make that story of the consistency of the change. So again, using that structure, you have your singular rate all the way down to your groups of 4+ with those significant increases, primarily because it is a lower cost rate versus those higher costs. So those updates around flat costs or around proportions can be quite a bit larger in this context. Next slide. Just keeping an eye on that. Oh, we can't do chat. So used to that being live. All right, so here we are in the respite services. This is a slightly different story, primarily focused on these 15-minute rates were changed quite significantly overall, but again, not quite as large as the others. We see this 15-minute rate for each all the way down with that singular rate at the top, including those divisions plus 10% all the way down to 489. The current rates were increased quite a bit. I think the primary differences is also in how those rates were calculated. If you were starting to notice that change for 1 and 2 is different than 3, you're not alone. You can see that it's 93% versus 110% increase. Again, that is ideally focused at not ideally. That is focused on a methodological change, primarily around that 10% figure and how it applies and at which stage. So overall, these rates are a consistent story with those other care coordination services. Next slide. All right, did we change the slide?
We did.
So I didn't, oh yeah, 97, 81. All right, thank you, sorry about that. So overall, the in-home services do quite the same thing. Primarily here, it's slightly smaller because it's a slightly higher rate. But overall, the inputs here are based on a complex blend of wages, rates, taxes, and inflation. And so all those operate in a little bit different way here. Overall, again, same story, significant increases across the board, really showing that we're investing in those cost factors and really making sure to benchmark to the costs as of 2027, which we all know are pretty high. All right, next slide. All right, so personal support services, Here we see the respite care in-home participant-directed option. These are the in-home services. Another component here worth noting is that this change of 142 and 122 is in alignment with those other costs that are similar. So again, you can start to look at all of these different costs within all the different contexts and how they overall align. But again, same significant increases from around $7 to about $16. So almost 150% increase. Very significant, but again, recognizing the changes to those costs in these service deliveries. All right, personal care services, agency PSS. We have 1, 2, 3, 4 all the way down. Draft rates are, again, significantly more. I think the primary difference between these, if I'm recalling, again, we'll show you how to look at all the models and you can compare each individual component. I believe this is the difference between travel when you start to think about the travel costs for these and how much travel is included. So that's worth taking a peek at. But again, same story overall. Primary increase of significant costs, primarily wages and inflation, and then significant increases with that additional cost or significant changes with that additional category of 4+ service members. Right. I knew there was a lot of slides. I was trying to do this as painless as possible. So hopefully you guys are keeping up. The personal support services for agencies only. Again, exactly the same as the others. You're starting to see a theme here. Consistency is key, developing good, useful services overall. Again, this is also helpful so you can start looking at how they're different and then why they're different if you would like. Next slide. Supportive skill building, respite, not in home. We're going to talk about that here in a second. So we've hit our first negative, unfortunately. It's not a huge negative, it's a small one. And we'll talk about what that difference is here in a moment. We do have a written statement about that. But the skills training services, skills training development, and skills training FPSO only are all small increases overall, which means that this rate was roughly calibrated correctly and didn't need a whole terribly huge amount of change. All right, so financial management is a pretty interesting story. So overall, these are new versions. You'll see the 2040 with the U6, U7, and A under the 19 versus the 18, 20, and 29 versions, all of which are monthly. And we are suggesting a slight decrease to that financial management rate from the participant-directed option under that monthly. And we will go into exactly what we expect to see there. But what you'll see here is this is a scaled version, and you're going to start to, and when you look at the models themselves, you can see which assumptions were different. Primarily, it's around the number of hours that we are paying for under each consistent primary component. So the base components of all these are all the same. It's really a difference in assumption for how the service delivery is expected to be delivered. All right, and I think we're getting there. All right, financial management continuing. So what you'll see here is these are actually increasing. Can you slide back one real quick? I just want to make sure I'm looking at these comparatively. So these are the lower version of the rates. So if you continue up, these are the higher, and we are consistent. We are proposing pretty significant increases to those financial management under the self-directed waiver of about 18% for that monthly cost, primarily focused on the number of hours. And then we have the fall prevention and the chronic disease management under matter of balance and living well, with very large increases for these 30-minute rate components. Primarily, again, focused on these are smaller costs, so their increase will be proportionally larger. All right. I think we're on, yeah. Respite, in-home per diem supportive skill building. These are our rate decreases. So we had 2 this time, so not terribly bad. But again, really trying to level out that these are making consistency between the methodologies. And here in a second, I'm going to take over and show you our appendix and how you can research out exactly what the changes are different instead of us spending 4 hours here going over each model component. So really trying to save you your time, but realistically thinking about it from the base, the nursing facility, the respite and care not in home is based on the nursing facility statewide base rate for direct care as part of the nursing facility rate reform. So we're really trying to align this to a rate reform that's happening overall in the system and making sure that these changes are in alignment with those larger changes. And then for the financial management monthly decrease, we've split this into two different rates, which I failed to mention, so sorry, but the initial assessment and then with travel. So that one with travel is the larger increase rate. And then the ongoing financial management support does not have travel, and so therefore is a significantly different rate there. So it really is to isolate out what kind of tasks are doing and making sure that the rates are aligning with the tasks more specifically overall. So it shouldn't be a large hit. So, all right, I'm going to jump over and take this screen real quick. Oh, man. Sorry for the wait. All right, so here is the appendix. The appendix is not in presentation form. It is in Word form. So when you take a peek at this, you'll see a Word document that you can review. Again, this document has all of the rates we've discussed today. So I'm not going to go over all of them. I want to make sure we have plenty of time for questions, but I'll go over a few just to kind of represent. We've already gone over a model in theory. Now let's go over one specifically. So the care coordination model here, try to find a full one. All right, so the care coordination service right here. So the maintenance visit, you can see listed out as we have covered before. You have the hourly wage from the rate blend that has been identified. What you'll see here, actually, I went in too fast. So what you'll see here at the top is you'll see the procedure code, the modifiers, all the explanation for exactly which rate this is so that you don't get too hung up on the title. But what you'll see right here is the BLS position blend in rate model, which says the care coordination blend at the very bottom of the index. You'll be able to see where that care coordination blend is, what roles were included in it, and what was each proportion, as we've noted before. So you really can trace these models all the way back to the very base wage. So you'll see that we use that direct hourly wage of $31.05 for this rate here. We added our benefits of $11.99 to get a total compensation for 1 hour of service of $43.04, right? So we have that total compensation cost for that role, making sure we're including all those additional costs. We also want to make sure we're working in that non-billable and travel adjustment. So we're adding in those hours for travel, the hours to do all those additional tasks like paperwork and scheduling, all those other costs that you have to do to make the work work. Then we sum that all up to get you to your direct service cost per billable hour. So this is all of the costs we've included per billable hour. Then you do your program support costs. So that's that 10%. And we use that 10% to do those other additional components, like paying for your support staff and the person that maybe works your office. And then you have your indirect costs per billable hour for your additional costs like your HR, your IT, all those other costs that have to go in to make sure that those services are delivered. And then we take those vehicle mileage costs based off of the IRS 70 cents per mile calculation that we've done to sum that all up to say, for this service of care coordination service, a maintenance visit, we would expect it to cost about $93.35 per hour. That said, we expect it to be done in 15 minutes based off of the models and the policy. So then we divide that total by 4 to get you the 15-minute hourly rate. So this is one without a group session. So let's go over here and let's drop down to multiple patients 4+. So what you'll see here is same situation for the PCA super visit. You can look here, you go and say, oh, it's personal support aid. All right, so you could go look at what that personal support aid blend is based on down below. And looking at that, so we now know that that one starts with a $19.54 hourly wage. Once you do the percentages, you have 1105 to get you your total compensation for just your direct service costs of $30.59. All right, so continuing this on, going through all the different components, you add on your program support, you add on your indirect, you add on your mileage, just like we said. So we're assuming that this service will cost for 1 hour $67.82, but this is for 4 patients. So we take that $67.82 for the total hour. We are assuming this is a total hour of cost. So for that total hour of cost, it is then divided by 4. That hour is then added another 10% to get you an hourly cost of $18.65 for each individual in a 4-person group. So you can assume that for your 4-person group, you're going to receive about 10% more than $67.82. So that would be about $76 dollars or so. And so overall, you would get more than we're assuming the costs are to counteract the potential for having additional staff there to support those additional components. But overall, those are the rate models as we've developed them, and those are the components. Again, one more real quick, just scrolling through pretty quick down to the bottom. This view isn't the best, but when we get down to the very end, you'll see that we have all of our BLS positions listed, again, with the occupation codes, what those totally hourly wages are, what the blend is, and then how we built those based off of each individual member of that blend. So overall, again, you can see where they come from. You can do the math of each calculation and make sure that it's all done correctly, and be able to understand. It is all done correctly, by the way, but understand exactly how it was built. All right, but I'm gonna hand it back over to you, Kristen.
I'm going to pull our presentation back up, and we'll pass it over to you, Jessica, to walk us through next steps and Q&A.
Okay. Thank you, Kristen. I forgot to mention a couple of things earlier that would be helpful at this point. At this point, we will allow for some questions and answers in a second, but I want to say that when we get to that point, you can raise your hand, or you can also put stuff in the Q&A. But this presentation, we'd like you to clarify if this is an official question that you're asking when we get to that point, or if you're going to submit it in writing, or if you're just asking a question. And so as we move forward, next, I just wanted to make that clear. Next slide, please. So next steps. So what you can expect from this project from this point forward, the comment period, the written comment period is open now, and it will end July 13th. And this will be the same time frame for each of the 2 other sessions that we're doing. All the written comments will be due July 13th. And you can see that that's the rate reform email that we would like you to send your official written comments to. I've also posted that in the chat. So what I had explained earlier, then what we do with the comments after July 13th is we'll summarize them all, and then they'll be posted on our rate reform page, which I also posted that link in the chat for people to go to. It's a good resource for you to go to things. Things may be posted there from today's meeting before we send the notice out. On that note, also, that everything you're seeing today will be posted and will be available through a notice to links to the PowerPoint today, the recording today, and the appendix. So I wanted to let you know all that will be posted. And then we'll review the rate models based on the feedback that we receive, and we make any appropriate changes at that time. So participation reminder. So we are looking for very detailed review And we welcome your comments on the draft rates, and that's how our process is successful. So, based on your feedback, we may end up, raising rates, lowering rates, that sort of thing. So we really do review every comment we receive and we consider that feedback. And that is part of the 3173-J law. So I just wanted to make everybody be aware that we do really read every comment and we review them and we consolidate them and we consider them. So please give us your feedback. Next slide, please. So here's the part where you can ask your questions. If you don't want to raise your hand, but you want to put something in the Q&A, or if you don't see the Q&A, please raise your hand so we know that and we can submit it that way. But people can ask their questions now and they can be the official comment. What we ask is when you raise your hand, we'll call on you in the order that we see the hands raised. And we would like you to introduce yourself with your first and last name, title, organization, and your affiliation. And we also have quite a few people on the call, so we would like people to try to limit their comments to 3 minutes. You can always raise your hand again, get back in the queue. So how to raise your hand so you can ask some questions. There is a reactions at the bottom of your screen, and you just raise your virtual hand. So then when we see it, we'll be able to ask you to unmute, and then you'll be able to ask your question. I know we do have I did let somebody in who's on the phone. So if the person on the phone would like to ask a question, press *9, and that will get you through to the queue. So at this time, remind everyone, if you ask your questions today, we will be capturing them. Just let us know if it's an official comment you want us to capture. And that you can follow up with your written comments, because there is a lot of material to go through and you may want to review it before you submit it. And we understand that. There is the email that you will submit your written comments to, or if you have a question before you submit your comments, please let us know. We're happy to help. At this time, we'll open it up for any questions. Usually just takes one person who's brave enough to raise their hand.
Also, would invite folks, if you would like to see a particular model presented, as we only went over the general inclusion or inputs for the models, but if there's one in particular that you would like Jeremy to pull up so you can see the model, feel free to ask that as well.
And please don't feel like we are still here for you once you start reviewing all this. So the notice will probably go out in the next 48 hours with the links. And we will get this information posted to our website, normally within 24 hours of when we have our presentation. Okay, thank you. Jillian, I'm going to ask you to unmute. I'm trying. Jillian, go ahead. I did see it unmuted and now.
She can't hear me though.
We can hear you now.
Oh, I can hear
me now?
you. Yeah.
Okay, perfect. I did it a couple times. It wouldn't work. I don't know that this is official. I would say unofficial. And I don't even know if this is something you're going to speak to in this forum, but I've been a provider a long time. I think you guys know that. I've contributed to all your rate setting initiatives. But what I haven't stayed up on is the law that aligns with rate setting require the rate to be funded, because I'm just wondering that the rate is great. I don't really have any comments on what you did. I think that's phenomenal. It's just, is there any, the law that was passed when I was an advisor to MAC and all that work we did to get this rate to where it is today, which is amazing. Do you have to fund it?
So I think you might have joined just after kind of the opening remarks and reminders, Jillian. But we still don't have implementation timeframe because of a number of different factors, and that can include things like receipt
Budget.
and appropriation.
Yeah.
So yeah, it could be budgetary asks from the state legislature, approval there, rulemaking could be required, federal authorities, things of that nature all contribute to when and if the rates will be implemented.
Okay. Thank you for answering.
Okay. Amy, are you able to unmute? There you go. Go
Yep.
ahead, Amy.
Hi there. My name is Amy Adams. I'm with Home Hope and Healing. One thing I wondered is if there's going to be a rate distinction between CNAs and PSSs, or if that rate is intended to stay the same.
I apologize. Can you repeat that question in a slightly different way? Maybe it's my program knowledge that I need to brush up on.
Sure. Right now, CNAs, who are certified nurses aides, and personal support specialists who don't have to have certification until they've worked for 6 months, are paid the same rate of pay. The reimbursement is the same for both disciplines.
Mhm.
And we're wondering if that's going to stay the same or if that is going to change.
I believe that is the same because we do not make a distinction between the two in our rates.
And
Okay.
Amy, that might be something if you want to submit to the question that we could also take back, because I know Maine has the PSS individuals, and that might be something you might want to, bring up and let us know. That might be something to look at.
Okay. Thank you.
Thank you, Amy. Tracy?
Hi there, this is Tracy Smith. I'm the Long-Term Services and Supports Director with Seniors Plus. And this is a question for clarification prior to submitting written comment. And it's tied to the reduction for the nursing facility respite rate. And if I followed your explanation correctly, it sounds as though the assumption was based on hours paid for the service. Was that correct?
The reduction is not necessarily based off that. I would have to go back and look at the details of that. It was to align it with another rate, but I would have to see what the alignment change was specifically. So we'd have to get back to you on that one.
Okay, thank you. So my concern about the rate reduction is part of what I oversee as specialized services responsible for coordinating respite. And we are seeing increasingly difficult times of securing respite beds. And it's because of the reimbursement rate. So if we are reducing that rate, we are only going to face more challenges securing those beds. So we're already in a system where a client qualifies for a service and they're not able to obtain that service because of a rate that is not sufficient for the facility. And if we further reduce that, it's going to just create additional barriers. So I'll submit that portion for public comment, but it would be helpful to understand more around how that rate reduction was determined.
Yeah, thank you. That's really helpful to look into.
I'm going to jump in here, Jeremy. So this is Dwayne Parsons, and I'm the Senior Manager of Reimbursement for Maine Care. So I believe that respite rate was aligned with our nursing facility rate. So we just completed the nursing facility rate reform, and that rate is based on an hours per day calculation that's become a fee for service for nursing facilities. And the case mix for that was set to the average. So the case mix was adjusted to set the 1.00 case mix to the average Maine Care member. So the rate we're using is the rate that the providers get paid for the nursing facilities. It's a statewide nursing facility direct care rate.
Thank you, Dwayne. Is there a follow-up question on that? Okay. So I want to allow a couple of minutes for people to still think about if they had any overall questions or questions that are going to help you when you go through your review. Amy?
Hi there. It occurred to me under the legally required costs for Maine, is Maine paid family leave part of that legally required cost? It's rolled into that section.
That is part of the 8.15% that it's included in the benefits calculation. So yes, we have accounted for that piece of that in that the payroll tax cost.
Okay. And the unpaid leave limit change, was that part of that 8.51% as well?
I'm not familiar with the limit change. So
Okay, it used to cap out if someone earned up to 40, then it would cap at 40 and they could only accrue up to 40. But it's been changed so it's 40 per year, up to 80 hours total.
yeah, we'll probably have to research that a bit more. So yeah, I would submit that comment as written as the part of the written comments.
Thank you for those comments. Daniel?
Hi, can you hear me okay?
Yes.
Hi, my name is Daniel Cunningham. I'm with Maxim Healthcare Services. I just noticed that one of our bill code listings weren't listed in the examples used, and I was looking on the website. Is there going to be somewhere where it'll say the suggested rate for all of the bill codes on the site? I just couldn't find that.
Can you clarify which code? It's possible that it's going to be in a subsequent presentation, so just not in today's.
Yep, G0299 and G0300.
Okay.
Yeah, so that's the nurse and LPN billing codes under 96.
Yep, so that'll be in a subsequent presentation.
Okay, is that the presentation tomorrow?
I believe so, but let me just confirm.
Okay, great. Thank you. Appreciate it.
You want to go ahead and let Jillian answer or ask another question?
I was waiting for Kristen.
Oh, I'm sorry. I dropped the information in the chat for the presentation tomorrow.
Oh,
I thought we were
okay.
going to continue with
Oh,
questions.
I'm sorry. That's
Sorry.
that's me.
Yes,
Sorry, I
tomorrow.
missed it in the chat. So that is tomorrow's. And sorry for that, Jillian.
No worries. As you guys were, Jillian from Assistance Plus, as you were talking about, the last question triggered me. Could you review that non-billable part again for, we specifically do the PSS services, but I just wanted to see what is included in that rate, like client cancellations, that type of.
We do not have that level of detail for each of the rates currently, but we will definitely be able to provide that to you with a question response.
Did you have a dollar amount of what was being allowed?
Oh, yeah.
Yeah. Just to see, and then what it was before versus what it is now.
Can you say the rate one more time, please?
What was that? Oh, it was
Please.
I was looking at the PSS non-billable, like what the assumption was that you built into the rate for things that aren't billable, like when a client cancels. And then I was specifically looking at, like, I don't know to the detail you know, or if when, I can't even remember how long ago we did this, but the impact of the rounding rule requires write-offs now from providers.
Steal the screen. All right. So FSPO, FPSO.
No, this is a PSS like 1019.
This is where I'm the data guy, not the code guy, unfortunately.
Yeah, so just in-home PSS.
In-home PS. This is not a great way to do this. I'm sorry. Find it without scrolling through.
There you go.
In-home PSS.
I guess I'm going to ask while Jeremy's looking for that if does everybody have the Q&A function available? I know we haven't received any questions in there, so Jillian, is that available to you? Just so we know.
Sorry, I put it in the Q&A. Yes, it's working.
Oh, boy. I need to pay more attention to my chats and Q&A today. Thank you.
Sorry about the wait. I was trying to do it in presentation view and it is cutting off all the things. So my apologies.
I think it might be code T1019. If you control find, it might take you to it quickly.
Yeah. T1090.
T1019.
Thanks. Thank you, Kristen. Back to this. All right, so the agency PSS rate right here, we have the non-billable and travel adjustment is 1.54. But it is the way we calculated this is times the hour.
And essentially
Yeah.
that non-billable time, just like you were saying, is for components like report writing, or if someone has canceled an appointment, all of that time that's allocated to making sure that that appointment hour or 15 minutes, whatever it may be, happens successfully. So it's all of that time that you spend ensuring that it happens successfully that's not actually billable.
And this is 30.
I mean, the adjustment adds more than 50% to
Yeah.
the rate prior to
That's
the
what I was gonna say. It's about 50%
There's
or
a significant increase for all non-billable time included in the model.
So is that 6 and 7 on here? That just admin program costs?
No,
Well, no,
it's not. You
the non-
notice how writing is weird. It's the difference between this total compensation cost and the direct staff cost per billable hour. So it's about $16 per hour.
Okay.
And Jillian, I can say too, when we did the surveys and asked the questions and then had follow up as well, and in-person meetings or virtual meetings with folks, those pieces of non-billable, like the cancellations or, the travel time and those things. That's where we came up with that information to help identify what would be in that non-billable and that travel adjustment, because we understand there needs to be some sort of adjustment to account for those things that you guys are seeing out there in the real world. And as Jeremy had mentioned, and certainly Dwayne, that adjustment factor of 1.5%, when you take that, multiply it by that 50 or 3059, that gives you 4706 to account for those different variables that we heard directly from individuals and organizations.
Yeah, one of the fun parts of this being such a long project was this is a multiplier, so it's 54%, right? So it's so this is what we're multiplying by to increase it overall, not the dollar figure.
Perfect.
Thank you.
Just calling out, we have a little less than 15 minutes left. So we really want to hear from anyone who maybe needs something called out like that to be walked through. So it'll help you review anything on your own, or if you now have thought of a question or a comment, please let us know. And also, if we still have somebody on the phone, it's *9 if you're trying to raise your hand that I can see it so you can ask a question. So Jillian has a question. What year did the rate study start and conclude?
2024, and it concluded this year, right now.
Well, it's not concluded yet.
Right.
You're not, obviously. Yeah,
Still,
sorry, my fault.
still in the works. But as we discussed, I mean, this is a very significant effort. It touches on 9 different sections of main care policy and upward of about 130 different service codes. So it has definitely been, I believe it's been the largest effort of rate reform that main care has undertaken. So that's part of why it has taken so long.
Go ahead, Jillian.
Sorry.
No, you're fine.
So from anything after 2024 in either I would say in the non-biddable I'm trying to remember our PSS. Do you remember the date of our PSS licensing implementation? Wasn't it the end of 2024? I'm just wondering if we captured all the regulations we've been hit with kind of after this rate study, because I recall giving the information and then we underwent, the first time in Maine's history of PSS being licensed. So we would just have to make sure that that's accounted for in there, the amount of additional requirements that we have. We have those new on-hire requirements for supervision that never existed. And we have a lot more trainings as well. But I think when the PSS course comes out, it might level it out because they're going to reduce it. But for now, we have more requirements than we've ever had.
Well, I can tell you, Jillian, that if you look at the 1.54 factor
Yep.
that's used in this model and you compare it to all the other rate models that we've put out since we started undertaking the efforts, 1.54 adjustment is pretty significant and higher than most of the other services that we've done rate
Yep.
studies for. I would say that the 1.54 is probably going to be sufficient, or even more than sufficient to cover, whatever requirements on those non-billable time is.
Awesome. That's good to
So,
hear. I appreciate that.
I mean, typically you're looking at a 1.3 to 1.35 is usually the top end on those adjustments. So, I mean, it seems like there shouldn't be an issue there.
Perfect.
Yeah, the main care team has been amazing in trying to ensure that all those components have been represented. And again, I was trying to be really clear earlier about the alignment policies, but real hard work in ensuring that these alignments are done to each rate. And it's been incredible to work with them.
Yeah. We have 9 minutes left. Here's your opportunity, like real time, to look at something with the team that put it together. And don't be shy to ask or raise your hand, or that's what we're here for. Well, I do just want to give people a couple more minutes just to make sure. Julian, your hand's up still out. Well, I'll allow you to unmute because I'm not sure if it's a new question.
I didn't mean to do that, but in the course of your rate setting, are you going to align the regulations at the same time, like section 1996, like full rewrite, or?
I think that's a good question, Jillian. Given that we don't know if and when these rates will be implemented, it's a bit hard to answer that, just because we don't know, one, what department priorities and rulemakings will be occurring, but also what necessarily will go into the writing or drafting of those rules. So
Yeah,
unfortunately,
it would just be ideal at some point. I don't remember the year they were last updated, but I know that we've carried forth like 20 years of verbal changes that never made it to paper. And I know you guys acknowledge those and we have them in a book somewhere, but it would just be really great if we could rewrite the rules that really align with the delivery and not just for main care, right? But it actually aligned with all regulations. So we don't have like 3 sets of rules that we're following that are all different.
Yes, appreciate the flag. We do, I mean, we have the LTSS team on this call right now as well, and we do still have the original list that you shared. We've since added to it. And I'd love to be able to comment on future rulemaking efforts, but unfortunately, I just really can't anticipate timing of that.
Okay, with 5-ish minutes left, do we have anyone who, we don't want you to leave wishing you asked a question. So also in the chat, you should be able to find all those links. So if you're like, oh, I should have asked this, or when you start looking at it, send a question to that rate reform email. Go ahead and go to the Rate Reform Systems website page. If you're like, hey, maybe it's there before the notice goes out, check. It might be there before the notice goes out. We want you to look at those things. Give us the questions. Jeremy's here for the tough questions, and Dwayne.
And a quick, and Jillian, just to give you an idea, when we're looking at those adjustments for the non-billable time, basically that 1.54 metric means that only 26 out of a 40-hour work week are billable, meaning 14 are not billable. So that's how much time is dedicated to non-billable time based on the rate model. If that helps you equate it from an hours perspective.
I'm sending the rate reform link in the Q&A. The website page. And then all this information is also on the notice. So when the notice comes out, which will happen very quickly. It's not going to happen today, most likely, but it will go out and it will have a link for you to get to the rate systems website page. Which will then give you the link to this PowerPoint presentation in PDF form. It will give you the recording. It will give you the appendix. It will give you all these things you need, and it will also give you the comment deadline date, which is going to be July 13th. And where to send that to. So,
I just dropped the web link into the chat, Jess, so you don't have
okay, thank you. Yeah, I think it kind of got lost. It was like up there, so yeah, thanks.
Yeah, I also added the email address to submit written comments to again as well, because it kind of ended up a little bit further up in the chat for folks. So hopefully it's a little bit easier to find. I really want to thank everybody again for their attendance today and the questions and participation. We, are really excited to hear your feedback. As I said, this, effort has been going on for quite some time now. And so your feedback is extremely important for us to take into account for the next phase of the project. So please submit written comments or questions so that we can address those in the next phase.
And no questions. We'll go ahead and close. Those of you who want to be a part of tomorrow's presentation, that went out in the same notice, and that one starts at 10 a.m., I believe. Okay. Thank you, everyone. See some of you tomorrow.
Thank you.